The consultant quirks were on display at the annual student pantomime, where students performed imitation of a selection of the hospital consultants. I was going to say that the students performed a caricature of the senior doctors, but the consultants managed to make a fairly good job of caricaturing themselves. The thickly evolving plot was interrupted by songs written by us, and usually at that time to a Gilbert and Sullivan tune. Piers Robertson, an obstetrician and gynecologist, had a notable presence in or absence from the hospital, prompting this song. When I was a lad I went to school, and at my books I was no fool. I got my A-levels 1, 2, 3, including a distinction in biology. I did so well in biology that now I'm a consultant in maternity. When I was a student I made such a mark that my chief described me as very best clerk. I took all the bloods and I wrote up the notes, and I always wore the very whitest of white coats. Those whitest of white coats did so well for me that now I'm a consultant in maternity. Now I'm a chief, I rarely see any patients unless of course it's privately. I've made a lot of money and I'll make a lot more yet, but there's one job left in England that I'd like to get. There's only one job that would really please, and that's to be the man who... The rest of the song is not really suitable for a mainstream book like this, but refers to some of the activities of being the Queen's gynecologist. One advantage of being a medical student is that you get to see all the different specialities, albeit briefly, as you move from one to another throughout the course. It does not take long to realise that despite all the hype and importance that the consultants like to use to magnify the importance of their own line of work, the specialities are all fundamentally simple in concept. Cardiology basically concerns the heart, which is a pump, and a lot of blood vessels that are essentially blood pipes. So a cardiologist is just a plumber at heart. Nerves conduct by electricity, and so are really just wires, and the brain is one big computer. So a neurologist is a cross between an electrician and an IT technician. Most of orthopedics involves cutting and refashioning bones and joints, not much different from carpentry. A plastic surgeon is a painter and decorator that works on humans. One consultant, who obviously considered his own speciality to be on a more complicated plane, once described dermatology, study of diseases of the skin, as describe what you see, translate it into Latin, and treat it with steroids. None of this analysis to say that plumbers, electricians, carpenters, and painters and decorators are not complex, but many consultants might like to argue that their own line of work is considerably more so. But the first acquaintance with a speciality can be quite an eye-opener, often not what was expected, and sometimes causing an interesting glimpse into human nature. In psychiatry, I learnt of a patient with schizophrenia who was kept on the locked ward because one of his delusions was that he was King Edward IX. So far we've only reached number 8 in the Edward line. And that he had a rightful claim to the crown. He could not be allowed freedom because whenever he would run off to Buckingham Palace and claim it as his home. One day, he wrote a long letter to his psychiatrist explaining how he was misjudged and from where his thought processes had derived. According to the specialist, the letter made complete sense and showed that the patient's line of thinking was entirely rational, unlike most patients with schizophrenia, who, by definition, have disordered thought processes. Unfortunately, he signed the letter, "Yours sincerely, Edward IX." A young man came into the genitourinary clinic complaining of a discharge from his penis. Swabs were taken from the discharge and analysed. The consultant returned to inform the patient of the results. "I am sorry to have to tell you that you have gonorrhea, but we can treat that with medication." "But that's impossible," said the man. "The only person I have ever had sex with is my fiancée." "Perhaps you had better ask her to come in," said the doctor. Oh dear, one unfaithful fiancé. Not the best way for him to find out, and not the best indicator of a happy future marriage. It did not take me long to realise I could never do obstetrics. I know billions of women have delivered babies and it is normal, but it has always seemed to me to be a remarkable feat, deserving admiration, not one that I would like to undertake personally. How that baby comes out of the space available is remarkable, although sadly, sometimes it doesn't, without a bit of tearing or cutting. Thank goodness I am a male, a gender which, to date, has not given birth, as far as I am aware. Being a gynecology patient in a teaching hospital could also be problematic, it struck me, because students did have to learn to do internal vaginal examinations. And the only way, in the absence of any volunteers from the nurses, was to practice on patients. Not surprising then, when one young lady lying on her back and surrounded by a group of 6 medical students raised an eyebrow when the consultant asked her if the students would carry out a vaginal examination on her. "What, all 6?" she cried. Fortunately not. It was limited to 1. The other 5 would have to wait for other willing, or at least tolerant, ladies. Dr. Parsons was a pathologist, that is, someone whose work includes carrying out post-mortems on dead people. It came as a surprise to the hospital reception staff, therefore, when a lady arrived at the desk and asked if she could be directed to Dr. Parsons' outpatient clinic. When you sit as a student observer at an outpatient clinic, listening to the conversation between the doctor and the patient, you hear all sorts of strange things. And unfortunately, inappropriate answers to questions and statements tend to pass through your head. Fortunately, with experience, you learn that these things are definitely not to be said. When the patient explains at great length things that have no direct relevance to the symptoms, "Why are you telling me this? Why has this condition affected me?" Because it affects humans and you are human. "Migraine, you say, but I've never had it before." Neither has anyone until they have it the first time. "Are the tests really necessary?" Not if you don't want to know what's gone wrong. "Could it get worse?" Possibly, or it might get better, or stay the same. "Could it be something I have done that has brought this on?" Well, smoking 40 cigarettes a day might not have helped. "My husband thinks it's all due to stress." "Oh, I didn't realise your husband was medically qualified." Caution with even thinking this one, by the way, because unless you know otherwise, he might be. "My right breast is bigger than my left, but that might be because I am right-handed." Or your boyfriend left-handed. "It feels as if my ovaries are being pushed up into my chest whenever I have sex. Is that possible?" That depends on the dimensions of your boyfriend's anatomy. "You say I am pregnant, it's not possible." As far as we know, Jesus was the only immaculate conception, and you cannot cut pregnancy from toilet seats. Actually, one consultant I worked with as a junior doctor seemed never to have lost this tendency to speak his mind. On one ward round, he stood, as usual, at the foot of the bed, explaining the nature of the lady's illness and what could be done about it. Unfortunately, he addressed her in a manner that resembled a judge addressing an accused before delivering sentence. Halfway through his monologue, the lady had the temerity to interrupt, giving the beginnings of what could have been a long exposition on her sister's opinion of the predicament in which the patient found herself. "What your sister says is not important," he declared, "but what I am saying is." He could also be forthright in his views in writing. A letter to the general practitioner began, "I saw this lady with purple hair and tinted glasses in the clinic today," and concluded, "There is little doubt that she is suffering from neurosis and has no physical disease. However, to ease her mind, I am arranging for her to have a brain scan." A further letter, a week or so later, explained that the brain scan had shown a tumour. Not to be diverted from his opinions, however, he went on, "Isn't it fascinating that beneath obvious neurotic behaviour and symptoms there can be physical disease?" To be fair, one could argue that the symptoms had nothing to do with the tumour, but it is an unfortunate way of expressing it.